All right, well, let's talk about some of those issues, and I'm joined now by Dr Kerrin Begg. She is, of course, a public health medicine specialist from UCT's College of Medicine. Dr Begg, thank you so much for joining us. Let's talk about side effects and contraindications. Side effects, of course, are the things that you can expect. Often happens when you have any sort of vaccination with a jab. Doesn't necessarily have to be serious, doesn't mean you shouldn't be taking the jab. So let's start with the side effects, which may be quite common, I would imagine.
Correct. So we know that all vaccinations, including baby vaccinations, have side effects.
I'm going to let you have a little bit of water there to clear your throat, and I hope that doesn't mean that you're getting sick. I hope you're in good health. You were saying that, of course, we do expect, when we vaccinate our little ones, we do expect a mild fever, sometimes a little bit of elevation at the site, but that's not necessarily anything to worry about. But I'm thinking specifically when it comes to side effects for elderly people who may have comorbidities, who might be a little bit more frail. What are some of the side effects they need to be aware of with this jab specifically?
So the elderly will have exactly the same kinds of side effects as anybody else, including our babies. So we have local side effects, are the most common, with pain and swelling at the site of the infection, and then generalized. So similar to getting a flu jab or getting any of your local vaccinations, you will have flu-like symptoms. Because it's a flu-like illness, remember that the side effects, what happens is that your body is mimicking, is having the immune response. So similar to having the immune response when you have the disease, such as flu or COVID, is that you get some similar symptoms because your body is mounting an immune response. So in fact, you should be very grateful when you do have some of the milder side effects, the common side effects, because it tells you that the vaccine is doing its job and your body is mounting an immune response. So the flu-like symptoms would be like a headache, a fever, aches and pains, tiredness, and those usually start around 6 hours after the vaccination has been given, and then usually peak around 24 hours. So within the first day, you may feel quite flu-y, but they usually subside within 2 to 3 days.
All right.
Most people, after a good night's sleep, feel a lot better and carry on with life as normal.
Yeah, and some people, of course, have no side effects at all, is my understanding.
Like me, I was almost disappointed.
I have to ask you, at what point should you call your doctor when you're having a side effect? At what point do you go, hang on, when is it something to worry about, is essentially what I'm asking.
Okay, so the first thing is that all of the vaccines, you get your little card and a little an indication to call the vaccination site as well, should you, and an after-hours number should you experience anything. So that's also quite useful, is that you can phone in and check. But anything that requires more than Panado or Brufen, to take your symptoms away, anything that would last longer than 3 days, and anything that is severe that you're unable to continue with normal functioning. So you may just need a rest, a nap, and then pick me up, and you may just feel a bit flu-y. But anything worse than that is a good idea to contact either the number that's given to you at the vaccination site or to call your doctor.
All right, so mild pain relief or rest is probably all that's going to be required if you do have any side effects. Now, contraindications, that means against taking it. What are contraindications in this regard, regarding these jabs?
So interestingly, a lot of contraindications to other jabs and to other medication are in fact not contraindications to COVID. So if you've had COVID before, we still advise that you take the vaccination, but yet you should wait 28 days after you've had COVID. If you're in quarantine because you've had contact with somebody who's had COVID, then we suggest that you wait until you've finished quarantine, and if you've had no symptoms, then to proceed with vaccination. If you are pregnant or breastfeeding, that has just been a great release. We've had, obviously, as millions of people are being vaccinated all around the world, pregnant and breastfeeding mums have been receiving vaccinations, and we had a short pause with the J&J vaccine, but actually now the data is very clear that the vaccinations are safe for both pregnant and breastfeeding women. So none of those are contraindications. The only contraindications or reasons for you to check first. But that will be done at the vaccination site as well, and should have been done when you register. Is, have you had any severe allergic reactions previously? In other words, anaphylaxis. So not having been a bit itchy, or you had a bit of diarrhea. It's really, have you had a full-blown anaphylaxis that required treatment in hospital? And then any clotting disorders, you also just need to check. So not all clotting disorders are contraindicated, but if you are on anti-clotting medication, then you should check with your doctor or check at the vaccination site.
All right, so that's important information. I want to talk to you about wastage concerns and walk-ins. We know that some facilities are allowing walk-ins, and my understanding is that is an attempt to avoid wastage. The Pfizer jab has to be stored at very cold temperatures, take some time, I would imagine, to defrost or to be put into a usable state. How much of a concern is wastage at this point around the Pfizer vaccine?
Yeah, so I mean, in all vaccination programs, we're always concerned about wastage. So it's nothing new with COVID. It's just obviously that the level, the limited supply means that any wastage is just terrible for us to consider. And because, we really are just needing to spread vaccination as far as possible. So the wastage is a concern, and really what we want is, which is why appointments are so important, because we want to make sure that when you arrive at the site that you have a vaccination available for you. But at the same time, if you don't pitch, then your vaccination may go to waste, the vaccine that was set aside for you, that was defrosted. And once it's been defrosted, it can't be refrozen. So during the healthcare worker campaign, phase 1, we would have some no-shows, so people who either weren't able to leave work that day or were unwell, and then the next people on the list would be called in so that those dosages did not get wasted. Obviously, not everybody has access to be called at short notice, and so they may find it difficult to come in. And so walk-ins, and so there's a double-edged sword with walk-ins. One is to be available sort of later in the day, but the other is that when people have taken the time and effort and maybe also find it quite difficult to find transport, that we'd rather vaccinate them when they arrive than not. But obviously then you want to make sure that you have enough vaccinations for the remainder. So it's a little bit tricky to judge because, and that's where people get very upset, because it is dependent on sites. So, the further away you are from a centre, the harder it is for people to access. You really don't want to have to turn those people away and let them come back another time, because they may not come back another time. Whereas in urban areas which are close to public transport, it's easy access. It might be in a very well-to-do area that people do have access to return. And I think that's why, just to jump in, sorry there, but just to jump in, I know that the Department of Health is saying you do get automatically booked if you miss your appointment. But you were going to tell me something really interesting about the expiry dates of the Pfizer vaccine, which has now been extended. Just briefly tell me about that. Absolutely. So both vaccines currently are frozen and need to be thawed. And obviously the advantage with J&J is that it can be stored in refrigeration temperatures. The challenge with Pfizer up until now is it's really need to be at very low temperatures, which is why we've kept and reserved Pfizer, because it's 2 doses, which means we need access, and because it has it needs to be frozen at these very low temperatures, and we don't have those many freezers, low temperature freezers kind of dotted around the country. So we've just had news that's been released overnight that Pfizer has now been tested and is still viable after 31 days at fridge temperature, which is really wonderful news. So in other words, it can be kept and stored in areas that don't have the very low temperature
right. And what was
facilities,
it
very low freezers.
And what was it before?
It was 5 days.
Oh, that's an amazing difference. Wonderful. Thank you so much for bringing us that really important information. That was Public Health Medicine Specialist Dr Kerrin Begg.